don't think I ever started without the jury. All right, let's go.
The state calls Gage Grosskreutz.
Can you please raise your right hand? Do you solemnly swear the testimony about to give in this matter be the truth, the whole truth, and nothing but the truth, so help you God? You may be seated.
Could you please state your name and spell your first and last name for the record?
Gage, G-A-I-G-E, Grosskreutz, Grosskreutz.
Have you ever been convicted of a crime?
Yes.
How many times?
1.
What city do you currently live in?
Milwaukee.
And did you grow up in Milwaukee?
For the most part, yes.
Did you have any experiences growing up that made you want to get into the medical field?
Many, I think. I remember being a young child. My grandma was employed as a registered nurse at Columbia St. Mary's in Milwaukee. Like I said, being a small child, I remember her teaching me how to use a stethoscope and a blood pressure cuff. I'd say that was probably my earliest memory when I decided that I wanted to pursue a career in medicine.
Where did you go to high school?
West Dallas Central.
When did you graduate?
2012.
And did you find opportunities to put that early desire to go into medicine into practice?
Yes.
Tell us about that.
I remember when I was a sophomore in high school, and I was on the swim team, and my swim captain had come up to me. Lifeguard. So from there, I worked for the Milwaukee Lifeguard Corps, and then from there, I went to school to be an EMT basic. After completing that course, I then worked as a EMT on a private ambulance in Milwaukee.
Can you tell us a little bit about what you had to do to complete that course?
So EMT basic is, I believe, 160, maybe 180 hours. Essentially, that comes to a couple days a week out of a semester. And then following that, after successful completion of the coursework at the college, you then take 2 nationally registered courses, or tests, I should say. One is a psychomotor course, so that's a psychomotor course test exam, and that's essentially the hands-on technical skills. And then there's a cognitive exam, and it is a computerized exam where you take multiple choice questions in various fields of pre-emergency.
Was those two classes that you described, were those necessary to finish up the EMT basic program?
Correct.
And was there anything else you needed to do to finish up that program?
Apart from submitting an application to be licensed through the state, that's essentially it.
Are you familiar with the requirements in order to become an EMT in Wisconsin?
I am.
What are those requirements?
So just to recap, finishing some sort of college coursework, whether it's an EMT basic, or if you go on for an advanced EMT or an EMT paramedic. So the coursework through the accredited college is the first thing. And then following that is the, like I said, the two national registry of EMT exams that you take. Once you complete those and pass them, then you submit an application to whatever jurisdiction that you'll be working in. Because while you might learn, this much, you're only able to potentially do this much given local protocols and laws.
Did you complete all of that yourself?
I did.
Did you obtain a certification from the state of Wisconsin to be an EMT?
I did.
And did you put that into practice?
I did.
How so?
Like I mentioned before, I worked for a private ambulance in Milwaukee for a number of years.
Did you continue on in the field to get more advanced training or more advanced certification after that?
I did.
Can you tell us about that?
Yeah. So when I was working as an EMT basic, I decided that I really enjoyed it, and I wanted to advance my knowledge, my expertise, my experiences, and I went back to school to Waukesha County Technical College, and this is where I took the EMT Paramedic course.
Can you tell us about that course?
Yeah. Yes. The EMT Paramedic course, I guess a quantitative way to differentiate the two. EMT Basic is about 180 hours of class time, and EMT Paramedic is about 1,600. So for the specific course that I took at Waukesha County Technical College, I took 34 credits in a semester. The way that this course was structured is you would take a morning class, and an afternoon class. And this would go on for the entire semester. These classes would be, for example, one of the first two courses that I took was one course specific in treating trauma, and then medical emergencies. So there's a difference between those two. So morning class, afternoon class, and then at the end of 2 weeks, in this kind of condensed, really fast-paced, really hard-hitting courses, you would then take the exam for those. And then as long as you passed with a B or higher, you were then essentially able to move on to the next segment. So if at any point in this program you were to fail a course, say you failed your morning class halfway through, but you passed your afternoon class, you would have to wait for the next academic semester to go back, to reattempt.
Were you able to make it through that entire program?
I was.
Is that true for everybody else in your class?
It is not.
What was the kind of the dropout rate, if you will?
From what I remember, we had about 25 to 30 students. I was one of maybe 10 that passed.
Once you finished all of that coursework, did you get any new license or certification?
I did.
And what was that called?
That is the EMT Paramedic certification.
Is that from the state of Wisconsin?
That is.
Do you remember approximately when you obtained that?
2014, I want to say.
Can you help us understand the difference between an EMT and a paramedic?
Yes, I can. Like I said, a quantitative way to delineate the two is the amount of coursework. A simpler way that I like to put it to people is paramedics can put new holes in people. So some of the, sorry, would you like to
go ahead?
Some of the things, for example, are administering IV medications, so knowing how to start an IV. Also, cardiocentesis, which is essentially a life-saving maneuver which involves extracting fluid from the heart. There's also a great deal of pharmacology knowledge that needs to be known. For example, EMT basics, can administer 6 different kinds of medications. Paramedics, and again, it depends on the jurisdiction that you're working in, but nationally, you're taught a little over 50 different kinds of medications. And that's not just names, but it's indications, contraindications, or when to use it, when to not use it, dosages, which can be dependent on weights, age, and then there's also just the general knowledge that's known. So while there are a lot more technical skills that you learn in pharmacology and things like that, it's also being able to identify and properly assess.
Certification as a paramedic, did you work in that field?
I did.
Can you tell us about that?
Like I said, I had been previously employed on a private ambulance as an EMT basic. I then continued to work on a private ambulance as an EMT paramedic.
Did you ever do any of that work here in Kenosha?
In Kenosha, no, but in Racine, I worked for Erickson Ambulance for a time.
During your time working as a paramedic with that private ambulance company, what sort of medical emergencies did you have to respond to?
So Erickson Ambulance does primarily, I think almost exclusively what's called inter-facility transports. So it's not like when somebody calls 911, Erickson Ambulance is the one to respond. Versus like in Milwaukee, there's essentially these calls are shared with the fire department and private ambulances, so the private ambulances kind of back up the firefighters. But specifically for Erickson Ambulance and Racine, when I worked as an EMT paramedic, our general patient population, so this was, a range of emergencies, anywhere from diabetic issues to potentially mental health issues. There's always the chance or the chance of trauma. Say somebody falls. Cardiac issues are also a big, a more I guess ubiquitous thing with the geriatric. Cardiovascular emergencies are a lot more common given the age of geriatric patients.
Do you remember approximately how long you worked as a paramedic?
I'd say about a year.
Were there ever times in which you had to deal with someone suffering from a gunshot wound?
Yes, I have.
What was that like?
It's difficult. Gunshots can be very traumatic, and I mean traumatic in the sense of the physiology of what it can do to the body. Obviously, there are numerous factors that go into it: the size of the caliber, where the person's shot, how many times, and when you are practicing in school, it is much different from when you actually go and put your hands on somebody who is bleeding. There's lots of blood, screaming. Generally speaking, there's somebody there that's frantic. So that not only are you having to focus on the patient, but you have to deal with the surrounding situation, which can be potentially, like I said, a frantic family member, say if it's an accident or self-inflicted. But also, it can be a dangerous situation to go into because, generally speaking, you shoot people to hurt them, and there's always that potential of continued on-scene violence. So it can be very hectic. It definitely doesn't get easier the more you do it. Maybe going through the motions, going through your mental checklist of things that you need to do. But it definitely doesn't get easier watching that, hearing that.
Since you obtained your paramedic certification from the state of Wisconsin, have you continued your education in that field?
I have.
Can you tell us about that?
went to school for outdoor education, and naturally through that field, you are finding yourself in remote areas where there is going to be some form of delayed care, meaning meaning that you aren't able to get to a hospital within an hour, and that's commonly referred to as the golden hour, specifically with trauma patients. I then took a wildland firefighter course, which I did complete. And then I also took what's called wilderness first responder, which is it's essentially the industry standard for people who work in the outdoor industry. Yeah, sorry.
Have you worked in the outdoor industry, as you say?
I have.
What kind of work have you done?
My first job in the outdoor industry was working as a sea kayak guide in the Apostle Islands.
A sea kayak guide in the Apostle Islands? Is that right?
Correct.
Okay. Go ahead.
And then from there, naturally through schooling and opportunities, I primarily worked with children, middle school age, and also from there I was am an American Canoe Association sea kayaking instructor, so I actually teach people how to effectively sea kayak. Bit of context, specifically for where I worked in the Apostle Islands, Lake Superior is very cold, can get very windy, which means very wavy, so it's maybe just a little bit more intense than maybe paddling around your lake cabin. Yeah.
Are you continuing your studies today?
I am.
And how close are you to finishing those up?
I have one more class that I need to complete to receive my bachelor's in outdoor education.
I want to turn your attention, Mr. Grosskreutz, to the summer of the year 2020. And we're going to lead up to August 25th. But before that, did you spend time that summer attending any protests or demonstrations?
I did.
Can you tell us about that?
After the death of George Floyd, I found myself, this was, I want to say, maybe 2 days after George Floyd's death, and I was out with a friend of mine who I actually took EMT Basic with, and we were out demonstrating. We were seeing what the scene was like. Seeing what the scene was like. We didn't make signs or anything like that, but like I said, we found ourselves down in Milwaukee.
And when you say you were demonstrating, what exactly were you doing?
Well, I think what I was specifically doing was just being in attendance.
But I want to make sure we understand what you mean by demonstrating. Were there people damaging property?
No.
Lighting fires?
No.
Was there any violent clash with police?
No.
What time of day, if you recall, were these demonstrations?
That specific first one, generally late morning into late afternoon.
So what would other folks be doing at these demonstrations?
People would be holding signs. They would be chanting various things, driving cars down the street. Yeah.
And you said you initially were there just kind of to see the scene?
Mm-hmm.
Is that right?
Yeah, correct.
And tell us what happened after that.
So after walking for a few hours, kind of starting to wrap the day up, and all of a sudden somebody starts yelling, "Medic, medic." And I'm walking, like I said, with my friend who I took EMT Basic with. I was like, oh, I guess you're right. And then I came over to a patient who had tripped and fallen over a curb. My guess is they just weren't paying attention, got their feet caught up. And the patient was all right after an assessment, advised to go to the hospital. Following that, though, I noticed that there was no established or even organized sort of first aid presence at these demonstrations. And from there, I was talking with my friend who I'd taken EMT Basic with, and we decided that we were going to offer our services voluntarily.
And did you do that?
We did.
Tell us about that experience.
So I had talked to some of the prominent organizers in Milwaukee, and we kind of laid out a game plan, or how we were going to organize this. Essentially, as medics, we decided that we weren't going to be actively participating in any of the demonstrations. I think there's essentially an ethic code that if you are providing medical care, you shouldn't necessarily choose a side, because everybody has the right to protest or demonstrate, assemble, freedom of speech, but also everybody has the right to do that safely. So very early on, we decided that we weren't going to actively participate in these demonstrations. From there, my friend and I outfitted his pickup truck into essentially a mobile first aid station.
In the time period that followed after that, did you and your friend with this mobile first aid station provide medical assistance at these demonstrations?
Yes, we did.
On approximately how many occasions would you say you did that? I think it's relevant for many reasons. It's establishing his background as a paramedic, which came into play on this particular evening. I think it also is drawing a contrast between him and the defendant.
I'll overrule the objection on the first ground.
Approximately how many times would you say you were out there providing medical care at these demonstrations?
I would say about 7 August.
And during that time period, what sort of medical situations would you assist in?
Primarily, it was essentially people not taking care of themselves. I mean, it was a hot summer. People weren't hydrating. People weren't eating. People weren't wearing proper footwear. So I would say it was, by and large, nothing sort of like medical emergencies. It was very, like I said, people not taking care of themselves. So, like I said, providing water, providing food, potentially bandaging, sprained joints like ankles, things like that.
You mentioned earlier that you felt sort of an ethical obligation not to pick and choose the people you would treat. Did you treat anyone who needed it, no matter what their political beliefs were or what side they were on?
Yes, absolutely.
I want to move to the night of August 25th, 2020. On that particular evening, did you come here to Kenosha?
I did.
Had you been working at your normal job that day?
I was.
You left to come down to Kenosha.
7 p.m.
Did you travel alone?
I did.
Sort of larger group or organization that was coming to Kenosha that night?
I was not.
Why did you personally decide to come down here that night?
Essentially for the same reasons that I stated earlier. We were all aware of what was happening in the days following Jacob Blake's shooting. People do have a right to demonstrate, and no way advocating for property damage or anything like that. But given the, I think we all can agree, chaotic situation of those 3 days following Jacob Blake's shooting, there was certainly a propensity for violence, or